Hi everyone, welcome back to my channel Pharma Talk with Imran. In today's video we are going to focus on historical perspective of microbiology. Means in this video we are going to study the contributions of different scientists in the field of microbiology. So this video might be very useful the students who are studying microbiology in BSc Nursing. So let us start the video. So here how the microbiology is came into existence. So it is developed gradually through observations, experiments and discoveries which are made by the scientist. These discoveries help us to understand the cause of the disease, how to get control over the infection, and what is sterilization and what is vaccination. So why this matters for nurses, especially to control the infection, like by hand washing technique, sterilization and by using PPE. So we will see the scientist one by one. The first scientist, who is called as Antonie van Leeuwenhoek. Antonie van Leeuwenhoek. So the year is 1632 to 1723. So he is known as the father of microbiology. He is the first person to observe the living microorganisms by using a simple microscope, and called them as animalcules. So he observed the bacteria and protozoa from pond water and from the waste particles, food particles in the teeth through teeth scrapings. So the key contribution is he proved that microscopic life exists. And then the another scientist called as Louis Pasteur. So he is from 1822 to 1895. So he conducted one experiment called as Swan neck flask experiment. So what is this experiment? So here we can see so here the Pasteur took a broth, that is soup, in a special flask with a long curved neck, that is called as swan neck. Here you can see the swan neck. So he boiled the broth or soup, that due to that boiling it killed all the type of microorganisms, and left the flask open to air. And the curved neck, another flask he took, that is one is having curved neck, another one is having normal neck. Then after this experiment, after boiling this, what happens? The flask which is having curved neck, it allow the air but trapped the dust particles, or you can say the microbes, trapped the microbes. Only it will allow the air. So what happened here in the case 1, that is especially in the curved neck flask, so air entered but dust got trapped. Here in this the air is entered but the dust is get trapped in this shape, means the microorganisms get trapped in this shape. Whereas in case 2, that is neck broken, that is flask tilted dust, means here there is no curve, only the neck is there, there is no curved shape is there. But here what happens? Here the dust, that is microorganisms and air, both are entered, and In this flask, the microorganisms start growing, but here there is no growth of the microorganisms, means there is no bacteria. So according to this experiment, this will give a contribution in germ theory of disease, and help in development of invention of pasteurization process and development of vaccines. Then what is this germ theory of disease? The concept is simple. The microorganisms are responsible for causing diseases. So according to this theory, any disease is due to the microorganisms, whether it may be bacteria or whether it may be protozoa or whether it may be virus or anything. So the disease is due to the microorganisms. So what is the importance of this invention? So it will stop the blind belief about the diseases, and it will move towards a scientific approach. That is, it will provide a foundation for the invention of drugs like antibiotics and other inventions like a sterilization process and infection control. Then another scientist by the name Robert Koch, so from 1843 to 1910, so he postulates one theory, that a set of rules to prove the microorganism cause a disease. So microbe present in all diseased individuals. So microorganisms isolated and grown in lab which are causing the disease, when they are introduced again in a healthy person, they will cause disease. Means this experiment prove that any disease is due to some other living thing, that is microorganism. So he extracted the microorganism from a ill person and he developed in the lab, and again that microorganism is injected in a healthy person, that is healthy host. So that person also get suffered from that particular disease. So this experiment proves that microorganisms cause disease. So he identified the bacteria which are causing these diseases like tuberculosis, cholera, anthrax. Then another scientist, that is Joseph Lister, from the year 1827 to 1912. So he introduced antiseptic techniques in surgery. So in earlier days, after surgical procedures, the patient will suffer from infections. They are called as post surgical infections. That is, after surgery that person will suffer from so many infections. So to overcome from this problem, he identified and introduced a technique called as use of phenol or carbolic acid in surgical techniques. So this reduces the infections drastically in surgeries, especially after surgery, that will prevent the infection, further infection, that is secondary infection in the patient. Then another scientist, that is Ignaz Semmelweis. So he invented hand hygiene. So Ignaz Semmelweis discovered the hand washing technique that prevent the infection, means that provide or play a very important role to to prevent cross infection, while handling the patients. So that will reduce the maternal deaths in the hospital. So the contribution is introduced hand hygiene practice. Then another scientist by the name Edward Jenner. So he developed the vaccinations. The first vaccine for smallpox. So he used cowpox virus to develop this vaccine, which is used in the disease smallpox. So contribution. So he is the beginning of immunization treatment technique. So here are some scientists and their contribution made in this table. So in the first column, the scientist name and their contribution. The first person is Leeuwenhoek. So he discovered the microorganisms. Then Pasteur, germ theory and pasteurization. Robert Koch, causing agent. So a disease. Why the disease happens in the person, what is the main cause for the disease. Then Lister, antiseptic surgery. Semmelweis, hand hygiene technique. Then Edward Jenner, vaccination. So here are some quick revision. Microbiology started with microscope discovery. Then germ theory provide microbes cause disease. That is, germ theory proved that microorganisms are responsible to cause any disease. Then Koch linked microbes to specific disease. Means if there is any microorganism is responsible to cause any disease in the host or healthy person. Then Lister and Semmelweis improved the infection control procedures. Then Jenner introduced the vaccination.